All right, folks, I've got B for you. We're discussing understanding dementia and Alzheimer's. Okay, for today's discussion, B. Here we go. Dementia is not a single disease, but a broad clinical syndrome describing a decline in memory, reasoning, and communication. And behavior severe enough to interfere with everyday life. Alzheimer's disease is the most common form, but there are many other types, such each with distinct biological causes and symptom patterns. Importantly, dementia is not an irreversible or inevitable part of aging, though age is the strongest risk factor. Major types of dementia. Alzheimer's disease, AD, accounts for 60 to 80% of dementia cases, characterized by amyloid plaques, tau tangles, and progressive neurological loss. Early signs include short-term memory lapses, difficulty managing routine tasks, and subtle changes in judgment. Progression leads to language difficulties, disorientation, and eventually loss of independence. Vascular dementia, caused by reduced blood flow to the brain, often after strokes or chronic vascular damage. Symptoms symptoms vary depending on the brain regions affected. Slowed thinking, problem solving, difficulties, and impaired planning are common. Then you have Lewy body dementia, LBD, results from abnormal protein deposits, Lewy bodies that disrupt brain chemistry. Hallmarks include fluctuating cognition, vivid virtual hallucinations, REM sleep disruptions, and Parkinson motor symptoms. Okay, frontal temporal lobe dementia, or FTD, involves degeneration of the frontal and temporal lobes, leads to personality changes, impulsivity, loss of empathy, and language impairments. More likely to affect people at a younger age 40 to 60 compared to Alzheimer's. Mixed dementia. Many individuals have overlapping path- pathologies, e.g., Alzheimer's plus vascular damage. This complicates diagnosis and treatment as symptoms may blend across categories. Other causes: Parkinson's disease, dementia, Huntington's disease, normal pressure hydrocephalus, and alcohol related Korsakoff syndrome. Each present unique mechanism and symptom clusters together. Risk factors and prevention. Dementia arises from a combination of age-related changes, genetics, and lifestyle environmental influences. While some risks cannot be controlled, family history, genetic mutations, many modifiable, cardiovascular health, hypertension, diabetes, high cholesterol, smoking, physical inactivity, and poor diet, social isolation, and untreated depression, hearing loss, which has been linked to cognitive decline. Researchers suggest that up to 40 to 45% of dementia cases could be potentially delayed or prevented through lifestyle interventions, regular exercise, cognitive stimulation, healthy diet, and management of cardiovascular risk factors. Diagnosis and evaluation. When memory or thinking problems interfere with daily functioning, clinicians conduct a comprehensive evaluation, medical history, and neurological exam. Give me 1 second, guys. Gonna hang this up. Sorry, guys. That was falling off of me. Okay, cognitive and mood assessment is done. Blood tests to rule out irreversible causes, thyroid disorders, vitamin deficiencies, brain imaging, CT and MRI to detect strokes, tumors, or structural changes, advanced biomarkers, PET scans, cerebral spinal fluid analysis. Blood tests are increasingly used in research to detect Alzheimer's pathology earlier, though not yet routine in clinical practice. Treatment and care. There is currently no cure for Alzheimer's or most dementias, but treatments can help manage symptoms and improve quality of life. Medications. Cholines, choline esters, inhibitors, and memantine can temporarily improve cognition or slow symptom progression in Alzheimer's. Lifestyle and supportive care, structured routines, cognitive stimulation, physical activity, and caregiver support are essential. Progression. Mild stage memory lapses, difficulty with complex tasks. Moderate stage language problems, confusion, behavioral changes, hallucinations. Severe stage loss of communication, mobility, and independence. Full-time care required. Caregiving, often demanding, requiring emotional resilience, community support, and practical resources. Key factors and outlook. Around 6 to 7 million Americans currently live with Alzheimer's disease. By 2060, this number is projected to nearly double to 14 million. Dementia is one of the leading causes of disability and dependency among older adults worldwide. Research is rapidly advancing. New imaging and biomarker tools for earlier diagnosis. Clinical trials, testing disease modifying therapies. Greater emphasis on diverse populations to ensure equitable understanding and treatment. Takeaway. Dementia is a complex set of conditions that challenge individuals, families, and healthcare systems. Alzheimer's remains the most common, but other forms highlight the diverse ways the brain can be affected. While there is no cure yet, prevention strategies, early detection, and supportive care can make a profound difference in quality of life for folks. Give me one second, folks. In the future of dementia research lies in the future of dementia research lies in combining medical intervention with culturally culturally responsive caregiving approaches that meet the needs of diverse communities. Okay, guys, anybody have any questions for me on this topic? I'm going to stay on for a few minutes and see if I get any questions or comments. So if everybody wants to open the floor for discussion, we can do so now. Like I said when I started this show, I'm going to leave this on for you all to give me questions and answer, or I'll answer your questions about um understanding dementia and Alzheimer's. Like we could start the question session of like, where does dementia come from? How, as gerontologists, how do we deal with it? You know, you could ask me those kinds of questions. I'll give you the answers to them. So